Welcome to Thursday's edition of COVID-19. I'm Min San-hee. It's been 150 days since the first case of the virus was confirmed here in Korea. Now, prior to the recent cluster infections in the metropolitan region, Korea's daily numbers even hovered on the single digits. We have more on the country's quarantine efforts later on in the program. But first, here are the headlines, as always, with our Kwon-soa and Noara. Welcome.
Hi, Sunny.
So let's start on the domestic front. I hear we have a rise in cases today.
Yes, so we have a rise from the 30s to the 40s, and now we are back to the 50s, which is a concern. So let's take a look at our latest figures. We have 59 new confirmed cases. That brings the total to 12,257. The death toll stands at 280, as we have one additional case of a death, and 32 more people have been quarantined in the span of a day, and 26 have fully recovered. Now, following last Friday, when the country registered 56 new cases, it's the first time in 6 days that the figure surpassed the 50 mark and even got close to 60. So definitely a spike from early this week when we were down to the 30s. And if we take a look at our map, most of the cases have occurred in the metropolitan region. In fact, 39 cases that includes the capital Seoul and nearby Gyeonggi-do province and Incheon. And then we also have 7 new cases in the city of Daejeon, and also sporadic cases elsewhere in the center of the country as well as down south.
Right, so do tell us a bit more about these new infections.
Sure, we have 51 new local transmissions and 8 imported cases. And as we just saw, it's not only the metropolitan areas affected. And it is the 5th time this month that the country has seen its daily caseload top the 50 mark, with the government having said everyday quarantine guidelines can be maintained if daily cases stay below 50. In the capital, as of Wednesday, there were 176 confirmed cases linked to a cluster infection at a door-to-door business, 76 related to a table tennis gym, and a total of 34 cases from a daycare center, with 12 additional people testing positive in a day. And as I said, a new concern is the city of Daejeon, as 15 cases were confirmed in 2 days linked to churches and marketing businesses. It's the first time Korea has reported a cluster infection outside the metropolitan region since May, and that putting authorities on high alert. Cases from abroad are also continuing to appear, with the pandemic far from being over globally, and we will have more updates on these figures later in our afternoon briefing.
Right, and staying on the international front, in Brazil, cases there, I hear, are rising, nearing 1 million cases.
Yes, Brazil remains the country with the second highest number of infections as well as fatalities, and the accuracy of those figures, which are already high, is being doubted, of course. And the South American country reported more than 30,000 cases in 24 hours and had over 1,260 fatalities on Wednesday. The city of Sao Paulo, the hotspot of the virus in Brazil, is nearing 200,000 cases with over 11,000 deaths, followed by Rio de Janeiro with almost 87,000 infections and at least 8,100 mortalities. The country is struggling to curb the spread, as testing is conducted at an almost 10 times slower pace than the U.S., with Brazil reporting only 7,500 tests a day. Now, in Central America, meanwhile, Honduras' president tested positive for the coronavirus, becoming the first Latin American leader with the disease. President Juan Orlando Hernandez said in a televised address that he began feeling ill over the weekend and was confirmed with COVID-19 on Tuesday. He said he had mild symptoms and will carry out his duties while in isolation and treatment. His wife and 2 presidential aides also tested positive.
And hopefully they'll make a full recovery. So the alarming rise, that is, in the Americas is what's keeping the global numbers high.
Yes, and the global numbers have now surged to over 8.4 million. If we take a look at our graph, we are seeing a steady rise, and we had 141,872 cases updated on the 17th. And if we take a look at the details here, we have 2.2 million cases in the U.S. with almost 120,000 fatalities. And we are seeing Brazil is nearing the 1 million mark with more than 960,300 infections, followed by Russia with over 553,000 cases. And the UK also almost at 300,000 cases now. And moving over to other figures, on our next table, we are seeing that Peru has hit over 240,000 cases. And also there has been change in Germany, which has a rise to over 190,000 infections now. And those are the global updates.
All right, so thank you for that. Stay with us for more on the domestic updates later.
Thank you.
And Arama, here we can buy more masks starting from today.
That's right. The supply seems to be a lot of supply now. And from today, people in South Korea can buy up to 10 protective face masks a week. Now, this is up from the previous limit of 3 a week for adults and 5 for kids. People who bought only 3 masks so far this week, so Monday to Wednesday, can purchase an extra 7 during the rest of this week, so they don't need to worry about that. Now, identification checks will stay in place, however, to prevent hoarding. The rationing system will stay in place until at least July 11th for the time being, and the government will monitor the production and purchase trends of these lighter surgical masks as well to decide whether or not to continue the system.
Now, blood plasma treatment is one option the government is looking at to fight COVID-19, and there are calls that tests need to be done quicker.
That's right. Song Jun-young, an infectious disease expert at Korea University Kuro Hospital, says blood plasma tests not only help in treatment, but also help determine the characteristics of the virus. We've mentioned this on a previous episode of the show as well. Now, in terms of treatment, it may help in herd immunity, but Song warns that test results can vary immensely depending on their accuracy, hence calling for a better accurate test results. And blood plasma tests also help in determining the scale of an infection, leading to calls for a speedier blood plasma trial amid the recent rebound in cases in Korea. Especially with the rise in silent spreaders who are unaware that they are affected. Song says there is more need for a better understanding of the virus and how it spreads. Now, blood plasma tests can also help in normal COVID-19 testing to give a more accurate result in that aspect as well. Now, Song's call may be answered soon, however, as there are more recovered patients willing to donate their blood plasma. This has allowed the government to plan clinical trials for next month, so we might see some positive results soon.
Right, and speaking of treatment, Korea is poised to conduct vaccine tests this month.
Yeah, so we're certainly picking up speed on this front. Korea intends to test a coronavirus vaccine candidate and potential drug treatments on monkeys later this month. Now, 2 experimental treatments and 1 vaccine candidate will be tested. The firms or research institutions that have developed the treatments and the vaccine in question have not been revealed so far. The test is part of the government-supported animal testing model, so more may come in the future. And the testing on monkeys is being conducted after the WHO actually earlier advised that such trials should be carried out in animal models before a human clinical trial, obviously for safety reasons. And the government has been supporting local pharmaceutical firms, research organizations and universities in developing a cure for COVID-19. The government adds that it will continue to do so, even if another country comes up with a vaccine. Now, currently 3 research projects are underway, and other local biotech firms have also joined the race to develop COVID-19 vaccines. So we could see some results soon.
That's good to hear. All right, Aram, thank you for that. We'll see you again on Friday.
See you Friday.
Now, it's a little after 2 o'clock in the afternoon here in Korea, and as always, we await the regular government briefing on COVID-19. Now, as we've been reporting this week, quite a number of the latest infections in the metropolitan region involve senior citizens at nursing homes and daycare centers. In fact, at least 6 senior welfare centers in the region have reported cases, and the transmissions at 4 of these facilities have been traced to infected staff members. Inspections of these venues also revealed poor hygiene practices, as traces of COVID-19 were found on various items, including wheelchairs. Authorities also found fault with the lack of proper disinfection efforts at these venues. What's more, activities that have been discouraged by health experts, such as singing in groups, were carried out at these centers in the absence of face masks. Accordingly, officials are renewing calls for a strict adherence to safety measures, including the wearing of face masks when in the presence of others outside of your home. we are still waiting for that briefing to commence. And perhaps while we wait, we can take a look at the daily life quarantine guidelines. There are 5 rules that you need to keep in mind, and the first one being to stay home for at least 4 days if you feel sick, and also to get tested if you do suspect that you have been exposed to the virus. The briefing is about to start, so we'll come back to you after it.
부본부장 설명이 있겠습니다. 6월 18일
Let us now begin our regular briefing for June 18th, Thursday, on the COVID-19 response.
지역사회 발생이 50.
We have 51 local transmissions today and a total of 8 imported cases. And that makes today's number to 57 cases today, and the total number of confirmed cases stands at 12,257. An additional 26 people have fully recovered, and a total of 1,177 people are in quarantine undergoing treatment. Yesterday, we had 1 more fatality. I extend my deepest condolences to the deceased and the members of the bereaved family.
지역 발생과 관련해서 국내
In relation to the local transmissions, we will update you on the breakdown of the regional transmissions. And in Ridgeway in Gwanak-gu District, Seoul, we have 4 additional cases being confirmed, and the new cases now stands at 180. And in relation to the newly planted churches in the metropolitan area, we have 2 more cases being confirmed, and a total of 119 people have been confirmed to date. And related to Seongsim Daycare Center in Dobong-gu District, Seoul City, we have 3 additional cases being confirmed under contact management. In total, 38 cases have been confirmed to date. And as for this center, out of the 38 people, 24 of them are users. And in Seoul Junggu District, we also had staff members of the Sicheong subway station. So these were the people who guided the construction sites. And after they have been confirmed on the 15th of June, we have 4 additional cases. And in Unpyeonggu District, Seoul City, we have a family who was confirmed positive. And in addition, we have 5 more patients there, and a total of 12 people have been confirmed. And in relation to the CCC of college students, we have a total of 14 confirmed cases to date. And in Bucheon of Gyeonggi-do Province, we also have the Kusong Psychotherapy and Counseling Center. We have 1 additional case, and the total number is now 5. And in Daejeon, at the Galmadong Seogu District, at the Dreaming Church, we have 3 additional cases, and the total now stands at 7. And also in Daejeon, in Seogu Gwaejeongdong, we also have a door-to-door sales business establishment with 7 more confirmed cases, and the total now stands at 18 to date. Last but not least, in the local transmissions in Jeollabuk-do Province, Jeonju, we have 1 high school student being confirmed, and at that specific school, we carried out disinfection and quarantine, and we are also tracing the contact management, and we conducted the epidemiological tests and testings for 963 people so far, and we don't have more cases as of now. And as for the 8 imported cases, 2 were from America, 2 from Europe, 4 from Asia, excluding China. The KCDC, as of now, we also would like to highlight that people should refrain from any small group meetings, especially religious small group meetings, and door-to-door sales business establishments, as they have been the major venues of transmissions, and leading to this has led to other venues of cluster infections, and we are at a crossroad where this could also lead to other areas and regions of the country. And we have also found that most of the venues were poorly ventilated and were at the basement floors, and the people there have gathered and engaged in a droplet-inducing behaviors, including singing, chanting, and eating together. And we also found that major cluster infections happened at areas that had poor quarantine compliance. And please remember that COVID-19 outbreaks can occur in any confined, crowded, and close contact environment. So we ask you to refrain from any gatherings such as social club meetings and religious small group meetings. And please practice 2-meter distance and also washing of your hands and wear your masks at all times. And please remember that people aged over the 65 are also high-risk groups, meaning that there is a higher possibility to transform into critical and severe conditions. So we ask you to refrain from going to places and gatherings where the places are poorly ventilated. And even you have to go to these spaces, please wear your face mask, please wash your hand, please disinfect your hands on a regular basis. And next are some updates on our R&D process. First of all, as for the therapeutics and vaccine development in the private sector, there are some companies and laboratories that have not secured and ensured of a laboratory with biosafety measures. We have also had the open call for these laboratories, and 13 of the institutions have opened their facilities. So we ask you for your participation going forward. And of them, 6 places are being in use right now by the private sector. And second is for the plasma treatment that is underway. As of yesterday, we have a total of 162 people who have showed their intentions to participate and donate their blood for our plasma treatment development. So thank you very much once again. Last but not least, as mentioned just earlier, COVID-19 is spreading very fast, and also it's spreading across all regions of the metropolitan area, and this is leading to Daejeon and Jeollabuk-do province, Jeonju as well. So we witness sporadic outbreak across the nation, and we need to be alert of the situation, and we need to also prepare ourselves for a widespread cluster infection nationwide. What we are mostly concerned of is the fact that non-registered sales business establishments were the major venues of cluster infections. However, this is now spreading very fast to other venues, including churches, after-school academies, and buses. So they are not only infecting the senior citizens at the welfare centers. However, now it's also infecting a lot of young people via foreign language academies and sport gyms. So we ask the members of the public nationwide to be especially careful for the senior citizens over the age of 65. If you need to have gatherings, including seminars or other training sessions, please switch to non-face-to-face alternatives. And also, we need to ask all of the staff and family members who have regular contact with these senior citizens to also protect yourself going forward and refrain from having small group meetings as well. The KSDC, we are currently witnessing implementing contact tracing for each of the confirmed cases, and we are also exerting our efforts to protect the lives of our citizens by developing the therapeutics and vaccines. Each nations are also introducing their accomplishments and the outcomes of their research, and here at home we are also closely cooperating with experts at home and abroad, and we are also exerting our full efforts to develop an effective therapeutic and a vaccine. However, as of the therapeutics, they are only concentrated and limited to be used on the patients with with severe symptoms, and we also have other possible side effects that is for these therapeutics. So we do have some restrictions there. We will be securing a lot of the supply of the therapeutics. However, we will be needing to prioritize the patients depending on their severe conditions. So this is another task that we have at our hands. As for the quarantine authorities, in short, we cannot say per se, in principle, overcoming the COVID-19 cannot be only relying on the vaccines and therapeutics. However, the underlying solution or protection that we can do is wearing a face mask and distancing in our daily lives. So we need to also evolve our way and change our way of living so that we can bring an end to the COVID-19. And this also means that we are living in a new era after the COVID-19 outbreak, which means that the society needs to change. Our social norms, our social structure also needs to change as well. And this also calls for our close participation. Thank you very much.
Right, that was Kwon Junuk, the Vice Head of KCDC, with Thursday's afternoon briefing. Let's begin with his words on the sporadic cluster infections.
Sure. Well, there have been a lot of cluster infections in the metropolitan area we've been talking about recently, but now the concern is that these cluster infections are spreading to other places of the country, including Daejeon. We see that Daejeon has a total of 7 cases related to a church and 18 related to a door-to-door business. So that's the same pattern we're seeing in the metropolitan area, because here in Seoul, we have 180 cases related to a door-to-door business, and in the metropolitan area, there are 119 related to smaller churches. So these are high-risk facilities, and also Kwon mentioned that people in the high-risk age groups should refrain from going to those places, especially if they're not ventilated enough. And last but not least, he also mentioned that some 162 people have expressed their will to donate their blood plasma. Those are the people who recovered fully from the coronavirus.
Right, well, that is good to know. All right, so thank you for that. We'll see you again on Friday.
Thank you.
Tensions are escalating on the peninsula as the two Koreas engage in a war of words following Pyongyang's detonation of a cross-border liaison office located in its border town of Kaesong this past Tuesday. For more perspective on this animosity, I have Professor Hannes Mosler from the University of Duisburg-Essen live on the line. Good to see you again, Professor Mosler.
Good afternoon.
Now, Professor, I believe it was at the start of the work week when we talked about cross-border ties and ways to ensure a more productive interaction. Well, things have taken a dramatic change as of Tuesday, and following the detonation, North Korea has vowed to resume military exercises and re-establish guard posts in border towns. How are you interpreting North Korea's latest acts of defiance, Professor?
Well, it's basically the same 3 things. North Korea is dissatisfied with South Korea not living up to their promises that they made in the various agreements since the summit in 2018. And they're angry at South Korea that it pays more attention to the US than to North Korea's demands. But the actual addressee of the performance is the United States, of course, by expressing their discontent with the US in this indirect way that allows them to bring a strong message across without risking too quick escalation. They demand that the US must provide sanctions relief and security guarantees first. Only then North Korea can break cover and make concessions from their side. But of course, Kim Jong-un also intends to impress its own people in North Korea. He promised to deliver economic wealth at the end of the current 5-year plan. But, well, we know as it stands, he will not be able to present much. And not less important, of course, is that his younger sister, Kim Yo-jong, can make herself a name as a respected authority in the regime. So that's why they're being tough recently.
Professor, South Korea, for its part, has strongly denounced North Korea's acts of hostility. Now, this response stands in contrast to its usual restraint to North Korea's harsh rhetoric. How do you believe should South Korea respond to North Korea's provocations?
Well, the South Korean government seemed to be taken by surprise by North Korea's recent outbursts, which was a surprise to me, frankly, because they should have known better. The North has continuously given clear signs of their dissatisfaction with South Korea's underperformance from their perspective. But not really much happened in Seoul as far as we can know. So that the Blue House finally raised its voice and refused to tolerate North Korea's despicable language habits any further, well, that was an appropriate reaction. South Korea is a liberal democracy and thus must maintain an attitude and a behavior that suits a liberal and a democratic country. So the government should try to clearly reject North Korea's hate speech acts and threats, and at the same time it should repeat their readiness for constructive dialogue.
What are your prospects of cross-border ties in the near future?
Well, we have to see that the provocations were well timed just after the general elections in South Korea and before the upcoming elections in November in the US. Also, there are various anniversaries in June, including the Singapore summit 2 years ago, the June 15 South-North joint declaration 20 years ago, the Korean War 70 years ago, and we should not forget the 75th anniversary of the establishment of the North Korean Workers' Party in October. So I suppose in the coming months we will probably witness more tensions. The provocation train has already left the station and it will be very difficult to stop it for some time. So inter-Korean relations will cool down for the time being, but there will be still sufficient time until the president elections in South Korea in 2022 to restart the dialogue and to make real progress.
Professor Mosler, what efforts would you propose to restart the dialogue on the cross-border here on the peninsula?
North Korea feels existentially threatened by the US, which is why there will be no real improvement until North Korea receives sanctions relief and security guarantees. But because the present US administration apparently does not want to accept that this is the only way to progress on the Korean peninsula, we can only hope for either a shift of the administration's position on this matter or a shift of the US administration itself. And that is why the South Korean government should try to convince Washington as well as Beijing to play a more constructive role in this process. The long-term solution will, of course, be a multilateral peace agreement, but at the moment, the South Korean government is left with limited options, and it should focus on damage control for the time being.
All right, Professor Mosler, thank you once again for sharing your thoughts with us live at this hour.
Thank you for having me.
Now, we touched upon this next piece of information in one of our earlier editions. A study by the University of California, Berkeley found that emergency responses to the global pandemic prevented more than 500 million infections. Now, here in the studio today, I have one of the researchers behind that study, Lee-Jae Chul, with me to tell us more. Welcome to the studio, Mr. Lee.
Thank you for having me.
Now, your study, which was published in the journal Nature, found that quarantine measures adopted by 6 countries, including Korea, substantially slowed the spread of COVID-19. Could you tell us a bit more?
Our motivation was clear. We wanted to know to what extent the COVID-19 preventative policies, such as social distancing measures, business closures, and shelter in place, were effective in containing the spread of COVID-19. We analyzed 6 countries: China, South Korea, Italy, Iran, France, and the United States, and we consistently discovered that those policies have substantially reduced the number of infections. During our sample period, which ended on April 6th, we estimated that the number of total infections avoided due to those policies was 530 million in those 6 countries we studied. And in the case of South Korea, the number was 38.5 million, the number of which is over 70% of its entire population.
What was the selection of the 6 countries based on, and how was your study conducted?
We had 2 main criteria for selecting countries. First, we wanted to investigate the countries which were the hardest hit by COVID-19 when we started the research. And second, we wanted to take advantage of the diversity of our laboratory. We have lab members from France, China, and South Korea, including myself. That helped us gather more accurate information about those countries. For this project, we first collected epidemiological data, such as the number of newly confirmed cases, and we estimated the growth rate of COVID-19 during time periods without preventative policies. Then we collected data on policy variables, such as the types of policies and the timing of policies, and we estimated the rate at which the spread of COVID-19 was contained when each policy was implemented. Finally, we analyzed 1,717 different subnational and national policies and ran simulations with and without those containment measures. From this, we calculated that those policies allowed those 6 countries in our study to avoid 530 million potential infections.
That's a lot of policy reviewing right there. Mr. Lee, according to your study, which country saw the most effective quarantine results?
When it comes to the effectiveness of those policies, there are various evaluation criteria. But in terms of the ratio of the number of total infections avoided to its population, South Korea was the most effective. South Korea prevented 38.5 million infections, the number of which is over 70% of its entire population. That was possible partly because the South Korean government quickly responded to the outbreak. For example, when the patient number 31 was identified, local government officials quickly responded to it, closing and disinfecting the religious worship places linked to the patient number 31. And this was immediately followed by other measures such as social distancing measures and the declaration of local health emergency. So South Korea's swift enactment of COVID-19 response policies helped the country avoid many infections.
Mr. Lee, what are the implications of your study amid the likelihood of a resurgence in infections worldwide?
The main takeaway is this. We should not underestimate the benefit of those COVID-19 preventative policies when deciding whether or not to ease those restrictions. It is possible that we are underestimating the benefits of those containment policies since the number of infections avoided is very difficult to precisely assess. On the other hand, the economic cost of those policies, such as the decline of GDP and the increase of labor unemployment rate, is constantly being projected in media. Therefore, when deciding the degree of those containment measures, it is very important to accurately calculate the benefits as well as the costs to the best possible extent. And we hope that our study can help us better evaluate the benefit of those COVID-19 preventative policies.
All right, and I hope you have more studies ahead for you. All right, Mr. Lee, thank you very much for joining us live with your thoughts.
Thank you.
수도권의 위험도는 5월 29일 이후 강화된 방역 조치에도 상승한 것으로 나타났습니다.
여름철 폭염에 위험한 계층이 바로 코로나19의 취약계층과 정확하게 겹칩니다.
Concerns over a second wave of COVID-19 here in Korea come amid concerns of a heat wave this summer. Accordingly, officials are calling for appropriate quarantine measures that factor in the weather as they fight off the virus. For more on this, I have Professor Chung Sun-jae from Yonsei University. Good to see you again, Professor Chung.
Thank you for having me again.
And I also have Frank Smith, foreign correspondent for Deutsche Welle. Hello, Frank.
Nice to be back, thanks.
Professor Chung, cases of COVID-19 in the metropolitan region is not showing any sign of subsiding. What appear to be the characteristics of this latest surge in infections?
Yes, we're really worrying about this situation right now, and the double-digit number of the confirmed cases of COVID-19 still continues to be like 30s to 50s. And I think the we have to focus on the characteristics about the elderly population infections and also the severe symptom cases. And I think in particular that we should be very alert to the situation that more than 50% of the asymptomatic infections occurred, and unknown infection path in the metropolitan area is highly increasing. So these signs can be a red flags that a subsequent explosive infection is possible in Korea right now.
Right, so we have more senior citizens who are being infected, we have more asymptomatic patients, and we have cases that are untraceable. Frank, what are your thoughts on this latest surge in cases here in the metropolitan region?
Well, to echo Dr. Jung's concern, I look at the contact tracing and the challenges that the government faces in conducting accurate contact tracing, especially in the midst of asymptomatic contagion. So that makes it extra difficult to find out who is infecting who. And you also have an increase in the number of cases which are untraceable. So that's, a recent survey has shown that more than 10% of the cases haven't been able to be traced, and that means that the contagion is uncontrollable. The government, as Dr. Jung and I were discussing earlier, the government has said that they want to see that number of untraceable infections below 5% to come up with the idea or to justify the idea that the virus is under control here.
Professor Chung, like Frank just mentioned,
Yes.
another source of concern, and as you mentioned earlier on, of course, is the reality that a growing number of cases here cannot be traced.
Yes.
Please tell us more about your thoughts on that.
Yes, as Frank said, it's like in the early May this year, it was about 5% of the cases were untraceable. However, now it exceed 10%, and which makes, I think, the quarantine authorities really nervous. This is related with the increasing number of the asymptomatic infections, and much as about 50% of the current infection, as I said before. And in this case, the symptoms are not expressed. So even if the cases are jammed all over the places, it's hard to trace. So after that, the protection is not possible. And this would be a very big problem from a public health point of view because it would be more difficult to prevent continuous virus transmission. And simultaneous explosive infection would also be possible within the community. So in fact, the government set the goal as to lower this kind of infection under 5%. And that was the time when we switched the quarantine prevention system into life prevention on May 6th.
Right. Professor Chung, I understand there is a study, this is on a slightly
Yes.
brighter note, there is a
Yes.
study that claims in the absence of stringent social distancing that we had observed, Korea would have seen 800
Yes.
cases a day.
Yeah.
Tell us a bit more about that.
Yes, this study was conducted with the NCC, National Cancer Center personnel, with the simulation result through the reproduction number, which we say R. And this represents to find out how many people are infected from one person. And for example, from March 14 to April 29th, the average of 0.45 people was infected to coronavirus from one person. However, from April 30 to June 11th, the average was 1.79. So this is a very important fact that because of the original R exceed 1, then the disease continued to spread to make epidemic. And it became very prevalent in the community. But if it stays 1, then maybe there is the infection exists. However, it became stable. But our goal is to make this R under 1. So which makes the disease naturally disappear.
Has the number ever gone below 1?
Yes, because from March 14 to April 29th, it was the number of R was 0.45 in the calculation. However, when we use this calculation from the June 11th, the number 1.79 to the simulation, then it'll propagate by 254 by June 25th and also 826 after July 9th. So ultimately, the key is to reduce this reproduction number below 1. And if we reduce like 0.86, which is like 50% less of the current level, then we can assume that it'll be reduced about 23 new cases per day after 2 weeks and 4 new cases after 1 month later.
Right. Now, amid the circumstance, Frank, the government has not chosen to reinstate stringent social distancing. We still have our daily live quarantine measures in place, but we do have tougher quarantine measures as well to combat the cluster infections here in the metropolitan region. From those measures, which ones have caught your attention?
Well, for me, for Deutsche Welle, I recently did a report about the QR data entry logs that some businesses are doing, and that they rolled it out kind of on a demonstration or a trial basis at some places. I visited Wandang Market in Goyang, where they had QR testing in place on a voluntary basis. And what I saw there was really interesting. They had at each gate, and this is a traditional Korean market, it's kind of a semi-outdoor market. At each gate they had people with tables set up with disinfectant and the QR testing people to explain how to use it, and the design that you would take a picture of on your smartphone to log in, so that they would know who had visited the market and be better able to do that kind of contact tracing that is so important to, again, get that number below 1. And what I saw was that very few people were doing it logging in because it was on a trial basis. But almost everyone was wearing a face mask. Many people were disinfecting their hands regularly. So those types of measures were being done. But social distancing, again, will be a challenge. Something like 80,000 businesses are being required to implement that QR testing. Hopefully they'll do a better job of it than happened with the written login that we saw so problematic with the Itaewon outbreak. But I think, again, that's one of the things that would help with the contact tracing and better containment of the spread of the virus.
Right. Frank, if there are any questions you'd like to ask Professor Chung, please go ahead.
Sure. I did want to ask about what's going on with the heat wave. Previously, with previous pandemics, we've seen how they kind of petered out when it got warmer. And there had been some hopes, at least, that the same thing would happen with COVID-19. Is that going to be the case?
Yes. In fact, at the beginning of the corona outbreak this winter, there was expectation that it'll diminish as the weather gets hot and humid. As a matter of fact, other type of coronavirus we know usually have this kind of seasonal dynamic, which means the outbreak occurs in cold period in winter and disappear in the summer. And however, this novel coronavirus remains unpredictable because the disease is still little known. And in fact, at the laboratory level, the heat and humidity can affect coronavirus. However, the major opinion presents that the corona propagates from person to person in the real world settings. So in this case, these external factors wouldn't affect that much in the propagation. So on WHO's official website, it is explained that from the evidence so far, the new coronavirus can be transmitted to all areas, including areas with hot and humid weather.
Professor Chung, do you see the upcoming heat wave then as perhaps negatively affecting quarantine efforts here?
Yes, I think the most big obstacle is wearing face mask. So people don't wear face masks because it's too hot and it's too humid too. And that makes virus spreading really faster. And also, in addition, many people gather in cafes, restaurants, or like shelters that are well equipped with the air conditioning system. And this hinders social distancing. And also the problem of using air condition itself was also raised in China, that some arguments were made that this air conditioners and also the electronic fans can spread coronavirus to the farther distance. And this hypothesis has not been proven with the sufficient evidence. However, the Korean CDC mentioned that even if an air conditioner is used, it's necessary to make ventilation frequently enough.
Right, like once every 2 hours or something.
Yes.
Frank, we are talking about the possibility of a second wave, and most medical experts think it's a very it's going to happen. The issue, of course, is when it will happen. What measures are being adopted perhaps in your hometown, Canada, I believe, to perhaps better prepare for a second wave of infections?
Well, the Prime Minister of Canada, Justin Trudeau, just announced that Canada and the U.S. are going to remain with the border shutdown through July 21st. We need to be reminded, too, it's still quite serious not only in the United States, but also in Canada with 100,000 cases and more than 8,250 deaths. BC, my home province, I'm from Vancouver, British Columbia, has 2,750 cases, 168 deaths, and 172 active cases. They've also decided to extend the Canada Emergency Response Benefit. So they anticipate economic problems over a longer time, and they're going to be dispersing up to $2,000 per month to people that have been put in unemployment because of the COVID-19 pandemic. So they do anticipate, again, a second wave and are kind of preparing on a number of levels for that.
Professor Chung, perhaps we can end the discussion today with a few words of advice to the public as members seek to keep themselves and others safe amid the possibility of a second wave.
So I think everybody knows about what we should do right now to prevent infection. And also social distancing is really important. Well, I would rather say physical distancing rather than social distancing. But everyday lives, I mean, the social distancing is really essential. And we know how to be important about wearing face masks, washing hands, and also using hand sanitizers. And additionally, with this kind of weather, most people have to stay inside. And it's important to ventilate regularly, just like twice a day at least. And indoor hygiene condition is also important. So make clean and sterilize the places every day where people can touch frequently. However, I would just like to say that the outbreak gets longer. It's important to keep your physical distance farther, but emotional distance closer. Please try to communicate with the others and check the situation of others, maybe by online or by using telephones. And also, please try to understand who were and who are infected and quarantined, and also who are working for the prevention. Please adhere to the information with credible sources and refrain from excessive information searching, so it'll help us, our physical health and mental health too. Thank you.
Professor Chung, thank you very much for those words. And Frank, as always, thank you for being with us.
Sure thing. Good to be here.
Well, that is all the time we have for today. Tomorrow, we explore changes in the cultural arena as efforts continue to better adapt to COVID-19 there. In the meantime, do reach out to us with your thoughts and inquiries through our social media accounts or homepage, arirang.com. Thank you for being with us.